everybody. Thanks for joining me today. I'm Jacqueline Boyd, Jackie to my friends, and I'm the founder of a company called The Care Plan. We appreciate you watching and subscribing and sharing these videos with your networks, especially for caregivers and LGBTQ folks and people who are wanting to take control of their aging process. That's who these videos are for, so thank you for joining us. Today I wanted to talk a little bit about what a care manager can do for you. Now, most folks don't even know that care managers exist. They don't know what we do, and they don't know the difference that we can make in someone's life. So I thought it might be helpful to talk a little bit about this underutilized resource. The reason why I'm wearing this shirt today is because it was made for me by one of my very good friends, Anna Deshawn of E3 Radio. Anna is a close friend and has been for a number of years, and we kept having the same conversation because she would tell me maybe the day of a surgery that she or her wife were having, or she would let me know that, she or her wife had not been feeling well months into the fact that they were having a healthcare issue. And I kept telling her, just call me first, call me before anything goes wrong so that we can figure out how to deal with it. Because there's so many ways that people feel, I think, disempowered by healthcare systems, right? When you start to need help or when something goes wrong, you feel badly enough that you're not feeling like yourself. And then you're encountering new providers, whole new language, new resources, and you don't have a guide to help you figure out what the right steps are. That's really what a care manager does, is we help you ideally plan for health and aging, but we also help advocate for you when those situations come up. So this shirt, call Jackie first, hashtag the care plan, keep it in mind. This is why we do what we do, to be of use to people and to use our expertise to make sure that you don't go through the same mistakes or recreate the wheel on the people you love the most. So let me give some examples of how care managers can help. So I think one of the things that most people don't realize is that a care manager can save you time. If you're a caregiver, as I said, you're learning a whole new terrain: aging services, healthcare, medical systems, insurance. All of that really should have some training to it. As a professional, I get trained every single month on what's happening, what's new, what's going on with Medicare and Medicaid. We have the expertise and the experience and have been down this path with hundreds, sometimes thousands of families. And so you can use the benefit of our knowledge to save you time. I tell folks who call us because maybe they think they might need caregivers for their loved one so that they can stay in their homes for longer. It will take us 2 hours to find you the right caregiver, to vet the agency, and to set up a care plan, when it will likely take you about 15 hours to do the same work with a different result, right? Because I'm a specialist. I know what questions to ask. I know what the price should be. I know if they are telling me the truth about if they have a great caregiver on the bench or if they have, just somebody who happens to be available. So there's a million different ways in which we can save time. That's just one example. I think care managers are also helpful in figuring out how to save money, right? Aging is expensive. In the state of Illinois right now, at the time of this filming, it costs $92,000 a year on average to live in a nursing home in a shared room. So aging, period, is going to be one of the most expensive investments of our lives. If you can figure out a way to do that with supplementing care, planning for care, and potentially using some of the resources that are out there, then a care manager is going to be able to help you think of those things so you don't have to do all that research yourself. I think the other important piece that's often overlooked when we are talking about caregiving and taking care of our loved ones is that a lot of you out there are taking time off to be with your loved ones. So you're losing money by having to go to doctor's appointments or check in if there's a fall or a meal that was missed or you haven't heard from your loved one that day. There is so much money that people are losing in terms of their wages because they're trying to manage it all. A care manager can help relieve that stress and let you do your job and live the important parts of your life while being assured that your loved one has quality of life. So that's the other way that a care manager can be helpful, is making sure that your financial resources last and planning for when they don't. So if you have a nest egg set aside, but you know it's not enough for round-the-clock care, or it'll run out at some point in time, we can help connect you to other professionals like elder care attorneys that can give you advice on how to spend down for Medicaid and plan for when your money runs out. So I know that's not the most exciting prospect, but it's a reality. Finances are a reality, and we're here to help you make sure that yours last and accomplish your goals. The other ways in which at least my clients have said that we've been valuable is as a thought partner and as an expert, right? Whether you're caregiving or taking care of someone else's health, it's a lonely road, and you don't always know who to go to for advice and just, am I making the right decision? What are my real options here? That's where a care manager can be incredibly helpful. I have clients that we talk with, maybe we do one session to do a care plan together, figure out, okay, this is the current crisis, how are we going to get through that? And then I don't hear from them for 2-3 years. And they come back when there's another issue, or they come back when they need a new plan for care. So it's not about spending a ton of money to have a consultant. It's about having trusted advice and the benefit of, at least for me, my 18 years experience in health and aging to make your path easier. I want to share a few examples, specific examples of how we've been useful to our clients, and how care management or patient advocacy, I don't care what you call it, but having an expert in health and aging at your side will relieve your stress and anxiety. So for one of our clients who doesn't even live in Chicago, she lives in Virginia. She lived with her husband. He was in a nursing home and had Parkinson's, and they were just movers and shakers and had such strong community around them. But he was in a nursing home with Parkinson's and had a diagnosis of Parkinson's for 10 years. When she called me, we talked about some of the issues she was having and the grief and loss that she was dealing with. And that's where it started. But then, as it went on, it came out in our conversations that her husband had been having urinary tract infections very frequently. And I said, well, how frequently has this been happening? He had been having urinary tract infections every month for 9 months. Now, to someone in crisis, to her, she didn't think anything of it. She thought, well, I guess this is just par for the course. He's in a nursing home, maybe this is just where his body is at. Through the course of our conversation, I talked with her about, has your urologist or your primary care physician discussed the disease progression of what can happen with Parkinson's, what it looks like towards the end of life? Have they talked with you about that, or about palliative or hospice care? It opened up a whole new conversation and possibility for her about making decisions that were in line with her husband's choices. So he had been so active and so energized, but because he wasn't able to speak up for himself, and because nobody had told them, listen, with Parkinson's, it's likely that a urinary tract infection or pneumonia or some other opportunistic infection is a very common way to know that you're at the end of life. It's a very common way for people to transition. Nobody had told her that. Nobody had given her that choice to make that decision to say, well, maybe we want to treat every single UTI that comes along, but maybe we want to do what he said, which is have the peace of mind and comfort at the end of life, so that he can transition out in the way that he was comfortable with. So I know this is a very serious example, but we don't shy away from the reality of the living and dying process. And I think that honesty is one element that can be useful for families that just don't know, where am I at in the aging process? Is this normal? So again, that's one example of a family that just really valued our honesty and asking the right questions. There's so many ways in which our healthcare system can and should do better, but those of us that are out here as care managers and as patient advocates are really trying to make that process smoother for you. So I just want to encourage you to reach out if you have questions, to call me, email me, call Jackie first, hashtag the care plan for a reason. It's so you don't feel unsure, anxious, or have regret that maybe you didn't make the right decisions. We can do this right, and we can do it together. So thank you for watching. If you have questions, or if this brought up anything for you, please put your thoughts in the comments below. We want to hear from you, and I will see you in 2 weeks with another video. Thank you, and take good care.